Family Planning Association of Malawi, Fpam, is an indigenous, non-profit making and non-political Malawian local non-government organization established in 1999 and registered under the Trustees Incorporation Act of 1962. Fpam is affiliated to International Planned Parenthood Federation (IPPF) as a member association. It exists to provide quality, accessible and affordable comprehensive sexual, reproductive health and rights information and services for young people, women, men and the underserved. Fpam Executive Director Donald Makwakwa says the organization will continue to support Ministry of Health's goal to save Malawians of reproductive age to access quality and comprehensive sexual and reproductive health information and services.
In terms of how we design and align our programs, we make sure that we align them with the government policies and strategic documents. So, as an organization, our main focus is on sexual reproductive health, and therefore we align our interventions with the government policies on health, including the health sector strategic plans. Now we have a much broader strategic document of the government, which is the Agenda 2063. So we also want to make sure that our programs are also aligned to that. In addition, we also look at the sustainable development goals. So our interventions also align with sustainable development goals, particularly goal number 3 and goal number 5. But we also regard all other sustainable development goals as cross-cutting to the work that we do. When this organization was set up, the focus was more on family planning. But over the years, we have broadened our scope. That's why we talk more about sexual reproductive health, which is much broader, and family planning is part of it. Now, apart from the family planning interventions, we also look at gender-based violence, we also look at cervical cancer, we also look at HIV and STIs. We also look at the environment in which we work as an organization. So we have another interest in terms of the policy environment. So we also do a lot of advocacy work to make sure that we have policies and legal provisions that are responsive to the needs of Malawi.
Fpam uses multiple service delivery channels to reach out to its target beneficiaries with quality and comprehensive sexual reproductive health information and services, which include static clinics, which are specialized facilities providing a wide range of healthcare services, including sexual reproductive health services. The organization also uses outreach clinics, during which a team of well-qualified service providers take the sexual reproductive health services to the people in the communities where tented clinics are set up. Fpam also uses a network of community-based distribution agents, CBDAs, and community reproductive health promoters who take the services door to door. Chipililo Chipunda is the district manager of Fpam in Lilongwe.
The services that Fpam provides have been provided in 3 streams. The first stream is the static clinic, a facility like this one where people walk in from their homes. The second stream is the outreach, whereby our mobile teams goes out and provide the services at near the place where people live. The third stream is the CBD, community-based distribution agents. Government has trained the agents that provide several healthcare services. So we are utilizing those structures because we're just complementing government efforts. All the services that we provide in all these streams or the service delivery points, they have been integrated to make sure that when a client comes at a room like this one, he or she wants to access the service, he makes sure that he has all the services under one room. So the services that we offer are family planning services, HIV testing services, cervical cancer screening, ARV provision, and general medical services. I just want to clarify on the general medical services because people, what they are thinking, they just think that Fpam is a recreation center or they only provide family planning services. Here we provide general medical services. When a client or a patient is sick, he or she feels malaria, he can come here and get a service for malaria. We have laboratory services. We do basic investigations for all the illnesses.
Fpam uses multimedia channels to disseminate sexual reproductive health and rights and HIV information and now COVID-19 preventive messages to its target audiences. The organization also provides services through volunteers known as community-based distribution agents, CBDAs, peer educators and counselors who sensitize, motivate and distribute family planning methods. Radio messages in all formats, including drama, are a key platform that targets to reach people in hard-to-reach areas and at most users in poverty. Considering that radio in Malawi remains a source of socio-economic development information, Fpam invests over 50% of its media budget on radio annually, and this has helped to shift social norms and behaviors towards community access to sexual reproductive health and HIV information. As explains Fpam's programs manager Tazira Chipeta, the organization, with support from other partners, also implements projects bordering on provision of comprehensive sexual reproductive health services among Malawians.
So basically about Fpam, in terms of our programs, we focus on very much enhancing access to sexual and reproductive health for the youth. We empower them as foot soldiers or advocates for their own sexual and reproductive health needs by making sure that they are ready to take up the leadership role in the community, to influence their fellow youth, to influence the community, to influence the policies in the different forums that they are found to be as they interact daily with the community on their needs. So we have HIV-related projects, we have SRH-related projects, we have advocacy-related projects that we are implementing. Some are at national level, or other projects or interventions are at district and community level. Our focus much is on the people who are hard to reach. As Fpam, we know that a lot of partners are in the urban area, but the population at large is in the rural area, and very few resources go towards them. As such, we take it as an opportunity to take interventions to that type of population so that them too can access quality services, can access quality and comprehensive information on SRH, but also can be empowered to take up a role as advocates for SRH services. So we go to the hard-to-reach areas using different methods of operation through outreach clinics, community engagement methods, but also trainings on capacity building for the youth as peer educators, peer navigators, and even youth CBDAs. So by that we mean the youth themselves taking a leading role to reach out to their fellow youth in terms of service delivery as well as information giving.
Currently, Fpam is operating in 12 districts including Chewu, Lilongwe, Kasungu, Mzuzu, Dowa, Dedza, Mashinga, Mangoshi, Neno, Salima, Nchinji, and Karonga.